Welcome to the March 2024 Healthy Ulster Council meeting. March already. Actually, it feels more like May out there. Welcome, everybody. We'll give it just a minute or two for people to join. We still got some people coming in, and let everybody come on in and welcome everyone. It's a beautiful day. Thank you for, I hope you're sitting near a window at least so that you can see outside. It's absolutely spectacularly sunny and warm. I'm going to start sharing the meeting PowerPoint. We're going to get going. Just have to move my toolbar a little bit. There we go. And off we go. So welcome to the May 14th Healthy Ulster Council meeting. We have a great lineup of people here presenting today. I'm first going to introduce myself. In case you don't know me, I'm Melinda Herzog. I'm the Healthy Communities Program Leader at Cornell Cooperative Extension of Ulster County, and I am the coordinator of the Healthy Ulster Council in partnership with the Ulster County Department of Health. And I would like to have my co-hosts also introduce themselves. Stacy.
Hello, Stacy Kraft, Public Health Education Coordinator.
And Jillian.
Hi, I'm Jillian Matthews. I'm a natural resource educator with CCEUC.
Thank you. We have some housekeeping rules. If this has been, whoops, I got to go back now. If this is your first meeting. So the first thing I'd like you all to do is please say hello by typing your name and organization in the chat box. That's sort of our way of taking attendance because your name isn't always perfectly under your picture on Zoom. So please do say hello by typing your name and organization in the chat box. Please stay muted throughout the presentations. We will be allowing for questions in chat. So if you have questions for the presenter, please type them in the chat box and I'll be reading them at the end of the presentation so that we can answer them. That helps the meeting to run along smoothly. We have a great agenda today. We'll have a presentation on the introduction to the Ulster County Medical Reserve Corp and also community strength through blood donation. So we're welcoming Ulster County Medical Reserve Corps and the Ulster County Department of Emergency Management and the Ulster County Department of Health, and also the New York Blood Center today. So I'm going to let our first presentation get going, the introduction to the Ulster County Medical Reserve Corps, and presenters are Mike Madison, the Deputy Director of Emergency Manager of Ulster County Department of Emergency Services, and John Wood. He's a contracted coordinator for Ulster County Medical Reserve Corps, along with Lizette McNulty, the Director of Public Health Nursing Services at the Ulster County Department of Health. And I'll stop sharing so they can share their screen. Go ahead, John.
Okay. See if we've got it. How's that?
Looks perfect.
All righty. Okay, so I'm not going to read these slides word for word for you folks because I know that the presentation will also be available to you later. So we're going to try to cook through this a little bit. So what is the Medical Reserve Corps? Basically, in 2001, after 9/11, the federal government realized that they had a need for a way to manage medical volunteers and public health type volunteers. And they really couldn't find one, so they decided to build one. In 2002, the program was then officially launched by President Bush. That was his famous all Americans should volunteer speech. What we really need is that again, but that's what started the program. It was the need to find an organization. Today, the unit itself, units across the country, there's over 800. They use both medically trained and non-medically trained folks. And what that means is that's anything from an EMT, basic EMT, all the way through physicians, and just about anything else in between, all the different types of nurses and things of that nature under the medical end, to include psychiatrists and mental health professionals. The non-medical folks, that's everybody else. Most folks will bring in their day-to-day job skills or the skills that they've had earned, and we can fit them into just about anything. So the when we say it in the community, the program itself is designed at the county level to be managed, but we get volunteers from all over the county to include surrounding counties. The program itself has a cooperative agreement with the National Association of County and City Health Officials. Again, that's a foundation that the federal government uses to funnel money and other types of program assistance to the locals. We commonly refer to it as NACHO. Again, that agreement helps us use our programs and get federal funding to do that. So in Ulster County, during COVID, the Ulster County Health Department realized that they needed a lot more assistance than what they could provide with in-house staff and contractors. So they subsequently started to bring in volunteers, and those volunteers were working, whether it was a testing site or an immunization site, to support that operation, both medically and non-medically trained folks. They had a pretty good group. I don't know the exact number, but they had a pretty good group working through that COVID process. But they also realized that they didn't have an in-house organization to help manage those folks. So they decided, after COVID started to settle, they decided to create their own medical reserve corps. So in 2022, they decided to hire someone. That would have been me. The reason they called me, my background is I ran the Orange County Medical Reserve Corps for 6 years. I took that and standardized it and made it a county unit. So they brought me in to help do that. And since then, we have been building the unit. In 2023, we applied for the federal sanctioning, the federal acknowledgement from the Federal Emergency Program, and we were accepted in September, which basically means we met all the standards that they had, and we had to come up with some internal controls and procedures and things like that to help keep the program running, both county policy-wise and the federal government-wise. So we have two primary missions. Because we support both the health department and emergency services, the mission is really to support their public health or disaster management roles. For the health department, most of their support is either going to be public education support, where we can go out and provide the stuff that they already have, like for early intervention, lead abatement, those types of programs, STD programs, where they can, where they try to educate the public, so we can support them with providing staff for that. During a pandemic, we would roll into whatever the prophylaxis would be, whether it would be immunizations or pills or whatever, and help with the dispensing of those. So those are the two primary functions for the health department. Under the Department of Emergency Services, the first one would be to supply staff to work in the County Emergency Operations Center. We use, during that, it would be like doing data collection or a call center operator or something in that line. The Department of Emergency Services also plays a big role in planned events like fairs, festivals, air shows, that kind of a thing. And what they've asked us to do would be to support those operations by providing first aid or some kind of medical treatment. We set the standard for that at pre-transport stabilization. So we would be using both medically trained and non-medically trained at all of those events. So again, real quick with the, if there's an incident, something that's not a planned, we have the emergency preparedness where we can help the public get ready, whether it's disaster preparation or creating go bags or anything like that. We can provide training for those folks and then an opportunity to practice that within the exercises. Emergency shelter operations, whether it's the actual running of the shelter or just the medical care within the shelter, disaster medical and behavioral health support. For those, we're more looking towards rehabilitation of responders and things like that, not necessarily providing that kind of care to the folks affected, although that's what we would be there for. But that particular bullet is for the responders. Medical surge, again, if the hospital gets overwhelmed and they need to set up some kind of an external hospital or something, we would help with that. Again, mass dispensing. And of course, the disease testing and surveillance, when we're talking about supporting the health department's mission, whether sampling for Zika or West Nile and that kind of a thing, we can also help with those missions as well. Again, we talked about vaccination clinics. The support centers, like the call centers or family assistance, family reunification, that type of a thing, helping set those up and run those. Any kind of patient movement support, again, if we're going to do a hospital move or something. The disaster cleanup and recovery, that would actually be us supporting the Red Cross in their efforts, where they're handing out those recovery kits and that kind of a thing. First aid and medical support, again. Community education, which we've already talked about, and of course, the emergency preparedness and response, and the logistical support, helping to set facilities up, those kinds of things. So the unit itself falls two categories: normal business and deployment. Under normal business, we're doing all of the administrative work, the recruiting, this type of public education work, helping develop or helping to work with the planning processes. So that's part of the normal business. Deployment is actually if we're being requested to do something, whether a planned event or an emergency, some kind of natural disaster, or it could be even something as simple as the city water fails in Kingston and the county is going to help with distributing water. We can support those types of things. Each of those has a slightly different chain of command. Under normal business, we would report to the Commissioner of Health or the Director of Emergency Services. Under those, you have the Director of Public Health, that's Public Health Nursing, that's Lizette, or the Deputy Director, that's Mike. And then myself being the next person in that chain of command for the administrative stuff. And then as we're actually working towards different events, we would report to whoever asked for us. If it's a health department mission, we would report to the commissioner. If it was an emergency management mission, we would report to them. Under those, you have myself, then you have the unit advisory board, which is to be staffed. We haven't started that yet. That's actually staffed with 6 volunteers and then a couple of folks from the administrative group. And their main job is to help guide this mission throughout the year. Whether it's different kinds of training or if there's changes in laws or policies or the way practices are done, that's part of their job. Special committees, that could be a newsletter group with editors and photographers and things like that. We actually would be putting out a quarterly newsletter. Hopefully soon we'll put out our first one. If we're doing, any other kinds of specialized work, we would form a committee for that. And then under that would be the unit members themselves. For the deployment, the biggest thing that would change in the chain of command is if it's if the county mission has to have either a county employee or an MRC coordinator supervising the staff. That's really the biggest issue. So if I can't make it to a particular event, the health department or emergency services would have to have somebody there that is familiar with county policies, rules, and regulations to support those folks. Basically, then the same type of stuff. Points of dispensing is one of the big ones. Shelter operations, we get a lot of requests for. So some of the potential duties. The staff would be used to either set up or break down a facility. That could be a shelter operation, a point of dispensing, or just some place to do non-emergency blood pressure screening. Distribution of non-medical items. Again, that could be gloves, water, cleanup kits. Mostly clerical. We do a lot of clerical and language translation, excuse me. Call center operators, we get a lot of requests for those. The unit's equipment itself, the unit has enough equipment to set up 4 external shelters, basically tents, tables, chairs, and all the supplies we would need to run that mission, whether medical supplies or managerial type stuff. Recording or documenting our deployment or an overall response, and non-emergency blood pressure screening. We actually do that a lot at fairs and festivals. It's a good way for us to educate the public about high blood pressure and other types of information we can give out. And then it also helps us recruit. It's a great opportunity for us to recruit. So to become a member, but again, both medically trained and non-medically trained volunteer staff must be at least 18. Currently, we're looking for folks that have a valid driver's license or a non-driver ID. Basically, we're looking for some kind of a government ID. We use that as part of the background check process. For those folks that are nurse practitioners or above, to include PAs and psychiatrists and physicians, the county is looking for those folks to carry their own malpractice insurance. Everyone else is covered under the county's general liability policy. Members are then selected from a pool of applicants. So when people are interested, they send us an application. I review the application as part of the background check, which may include an interview or some kind of checking any references. We do check social media stuff. Then the application is sent to the administrative group, the Commissioner of Health and the Director of Emergency Services for their approval. Once they're approved, then it goes over to county personnel for approval, and then we add them to the insurance policy and we notify them of their acceptance. If they have a professional license, doctors, nurses, and things, we also verify those as being valid. Then once we get them on board, we can start to break them up into categories of workers, whether medical or not. If they bring any specialized skills, that may depend on how we use them. I love when folks tell me that they are currently or used to be a warehouse manager, because a good portion of our work is logistics. So we like to have those kinds of folks. Once we get them on, they need to take some online courses, the FEMA Independent Study 100 and 700, that's the Basic Incident Command System, and the Basic National Incident Management System. We also have them take the New York State Health Psychological First Aid, which is another online course. All of those courses, if you sat down and did them all in one shot, would take you no more than 6 hours. They have to go through a new member orientation. That particular orientation is 2 parts. One, it's an overview of the unit and its operation, and the other part are the county's required trainings, like harassment training and computer use training and those kinds of things, because these folks are being treated as unpaid county employees. We do put them on, we do carry workers' comp for them, and they are on liability coverage. The workers' comp is for medical treatment only, because they're not being compensated. So once they've completed those types of things, the first 5, the last thing they have to do is they have to attend at least 2 trainings, one being a basic training for pod operations or point of dispensing operations, the other one for the Emergency Operations Center basic operations. And then we want them to show up to another training or a full-scale exercise if we do that. So essentially, we're looking for folks, once they get past the initial orientation, to show up 4 times a year. That's the only thing they have to do to stay a member. So that brings me to do we have any questions? This slide here is how folks can ask for more information or a application, or if they have any questions or anything like that. The Participate Ulster website, we have a page there, and the email that's listed and the phone number, they come directly to me. Was that less than 20 minutes?
You did a great job. I'm reminding everyone to type your questions in the chat. if you have questions for John or Mike or Lizette, while you're adding your questions to the chat, I have a question. I'm just curious, how many volunteers are there currently participating in the program?
Great question. Currently, we have 13 volunteers that we've expecting to do their first orientation actually on April 4th. And then I have another 4 or 5 applications that I'm processing now. So hopefully by the end of the month, I'll have like 20 people.
That's awesome. That's awesome. How long is the training?
The initial training for the orientation, that should be about 2.5 hours. All the online training again would take about 6 hours. If you read every page. The regular trainings we do once a month, and they are 2.5 hours depending on the topic. We usually start them around 5:30, and we would end shortly there, a couple of hours, 2 hours after that. The current plan is we would be providing some food, refreshments in the beginning. That way folks don't have to worry about having dinner before they come. And then we would give them the training and send them on their way.
Oh, that's awesome. I'm going to put it out there again. Does anybody have any questions? And I'll also ask Mike or Lizette, is there anything you'd like to add?
Hi, everyone. I'm Lisette. Nice to see everyone. Thank you, John. It was a great presentation. I think you kind of covered everything. And I do see that there's a question on the chat about if we were involved in the COVID shots at the mall. Yes, absolutely. Our public health nurses, including myself, were at Best Buy for about 2.5 years administering the COVID vaccines, as well as out in the community at schools and at town halls and other places as well. Thank you.
Oh, that's great. Any other questions? And any comments from, again, anything else from John, Mike, or Lizette?
Just tell your family and friends. The fastest way for us to staff this unit is family and friend conversations. The only thing I'll add is a lot of folks have, volunteer firefighters or folks that work in the volunteer ambulance corps. What's nice about this program is we have no physical restrictions, and our train up time is a lot less than the 700 and some hours to become a firefighter or an EMT. So if they want to help their community, this is a fast way to do it.
Yeah, we do have a question from Juliana on what the qualifications or criteria are for volunteers in the program.
Anybody, as long as they're over 18 and they have some kind of a government ID, we will take just about anybody. At this point, we haven't turned down anyone yet. So, although we are looking for both medically trained and non-medically trained.
Great. Thank you very much. And do you admit former incarcerated individuals?
We do. There would be a conversation based on the charges. Certain charges we couldn't use in certain jobs. So we would have to have a conversation to see if they were a good fit, but yes, we do.
Great. Okay. Well, thank you so much. That was really informative. And we'll also, try to get the word out through our Healthy Ulster Google group. And do you have a contact that you could also put into the chat? Just type your contact in. We're getting a question about that so people can reach out to you.
Sure, as soon as I figure out how. There we go. Type message. Okay.
Awesome. Thank you. Well, that was really terrific. I'm going to move us along to the next presentation. But before we do, just making sure we move this, we're also going to, as you know, everything that we do always comes with evaluation. So we're going to launch a short poll. It's very quick. You just answer 3 questions. The questions really are, was the presentation relevant to your work or personal life? It's a yes, no, or maybe. And once we get 100%, we'll move to the second question. We've got 100%. So Jillian, you want to launch the second question? Oh, actually, hold on. I'm sorry. That really was, we're good. I'm ahead of myself. That's really for the second presentation. Thank you. Okay, so we're going to move on to our next presentation.
Hello, good afternoon, everyone. Let me
Yeah, while you're bringing it up, I'll just introduce you. We have Yadira Navarro, the Director of Community Stakeholder Relations, and Joanna Scaduto, Business Development Manager at the New York Blood Center. They'll be presenting on community strength through blood donation. And let me just move this so I can stop sharing so you can share.
okay.
And while Yadira is bringing her presentation up, I will remind everyone that you will have opportunity to network at the end of the meeting. We have a half hour of networking. I think I forgot to mention that in the beginning. So if you haven't been to a Healthy Ulster meeting before, we do have a half hour of networking ahead of us as well. Okay, welcome to Yadira and Joanna.
Great. Thank you so much. And thank you to the previous speakers for such great information. It's no coincidence that we're on the same meeting, as our topic definitely has to do with emergency preparedness as well. Joanna and I are very excited to be here this afternoon and share some information on who we are as New York Blood Center and also the invaluable act of blood donation. And we purposely titled the presentation Community Strength Through Blood Donation because it is truly one of the most direct charitable acts you can do for the community. So we'll kick off on who we are as New York Blood Center. If it will move forward, there we go. All right, so New York Blood Center is our local division, but we are actually part of New York Blood Center Enterprises. We operate 6 community blood centers in 13 Northeast, Mid-Atlantic, and Midwest states and have about 2,000 employees. We serve a population of about 75 million people in 17 states, and that is through the collection, manufacturing, testing, and distribution of millions of blood products to more than 600 hospitals in those areas. We have a 4-part mission, which first and foremost, of course, is to provide high quality blood products and stem cell services. But many people do not know what sets us apart from other blood collection organizations is we have a world-renowned research institute called the Lindsley F. Kimball Research Institute. So we're sort of a best kept secret in the state, but our reach through that institute has created things that have gone worldwide. We actually were the creators of the hepatitis B vaccine, making it safe and affordable for the general community in the 80s. And we also created a blood solvent, which was basically a blood purification process that's utilized worldwide. So we're really proud of our efforts there. It is part of our mission to develop new products through that research institute and our biotech endeavors to develop new products and technologies with a humanitarian impact. And of course, we want to be responsible for developing and training the next generation of leaders in the industry. So just some of the stats here, but again, as our previous speakers mentioned, we think it's very important to let people know that when it comes to blood donation, it's really wonderful to support so many charities. It's vital to make sure that the community has what it needs. But blood donations, the blood supply is a critical part of disaster preparedness. It is important that we have enough blood on the shelves, and not only enough blood, but at the right time and with the right diversity makeup so that we can supply the life-saving units to the patients that need it. We often hear from our hospital partners, they couldn't do the work unless the community steps up and provides the life-saving donation. So it's an important thing to be a part of. Here at New York Blood Center, we're also really proud to have the largest rare blood inventory, and we love to share information on this. So for those of you who are blood donors, you know that there are the different blood types, A, V, O, and AB, with the positive and negative. But depending on your genetic makeup, which often has to do with your ethnic background or your ancestry, there are markers on your blood that actually have a very direct benefit for patients, especially those that need consistent transfusions. So for example, our sickle cell or thalassemia patients, that really their only treatment option is continual blood transfusion. After a while, if they're not getting blood that's closely matched to their own, they start to develop responses to that blood, a negative response. So it's really great. You know, here in the tri-state area, we have such a wonderful mix of diversity that these units actually have the capacity to have a national and, again, worldwide impact depending on the needs of patients. And on that note, we're really proud to be a leader in sickle cell research and support. Through our research institute, we have a very longstanding commitment to these patients, not only serving their transfusion needs with the type of units that they need, but also to develop treatments, stem cell therapies, and we have a few local advocacy groups that we work with to make sure that we're letting people know that this is a community that needs our support. And again, that we're getting the right donations in our inventories for them. So on that note, I will hand it over to my colleague, Joanna.
Hi, everyone. So the story of three. So the number three comes up quite often in the blood world. 1 in 3 people, so about 33%, will need blood transfusions for some reason in their lifetime, which is a lot more common than people realize. With 1 donation, you can save 3 lives. Often I feel people don't think or don't understand what an impact they truly can and do make with each and every donation that they give. We have some wonderful dedicated donors who have saved literally hundreds of people's lives through continued donations throughout the years. So it's really just heartwarming to be able to meet some of these donors and their reasons for donating. And then one of the most shocking numbers is only 3% of the population donates blood. That number is one that not one single person has guessed right. No one realizes just how low it is. There's 60%, over 60% eligible to donate, but yet 3% that are donating. And that's where, we ask for your help in spreading our word and spreading awareness to this fact. And so that brings us to what we're looking to do currently. Blood donations have trended downwards, and recovering from COVID has been difficult for us, where we're seeing a decrease in community partners. We're still about 25% lower with community blood drives than pre-pandemic. And we have also dropped the number of first-time donors. And that's an impact that is going to hurt the blood inventory today, but also of the future. Because if you are a blood donor, your first time very well could have been in high school when you got to miss class and get cookies. So, if we can get people young in that first few years of being eligible, they are more likely to continue to be blood donors throughout their lives. So having that drop in first-time donors is truly concerning and a trend that we're looking to reverse. And this is the data specifically for Ulster County, so you can see a correlation where the number of donors are still below pre-pandemic levels, and the number of blood drives ran are below pre-pandemic as well. But to continue the talk of first-time donors and youth donors, nearly 60% of blood donors in Ulster County specifically are over the age of 45. So that kind of supports the trend and what we're seeing, where the first-time youth donors are at a decreased rate since pre-pandemic. And again, this number is concerning more for the future as our donors do age out. So after 76, you do need a doctor's note clearing that you can donate. And there are conditions that might prevent you. If you're on a blood thinner, certain conditions, you might not be able to donate after age 76. So that's where we're really looking for an increase in that youth population so that we can ensure the blood supply is there for years to come. We do have a blood center right in Kingston, Albany Ave. We're open 2 days a week there. And we are in need of support. We need your help. So there's different avenues where you can support the New York Blood Center and support the local hospitals with your blood donations. But this is what we hope is a very easy one. We are open Mondays and Wednesdays, so regular hours. You can come in, you can walk in and donate, you could schedule an appointment. As you can see, again, the trend has been downward, where the number of donors we're seeing has declined. So we are looking to reverse that and looking to spread our messaging to get more people to come to our center. So different ways that you can support us. We find that a lot of people, if they can't donate blood for their own personal reasons, they think that's where the support stops. But that can't be further from the truth. You can support us by raising awareness that the need for blood is out there, sharing some of our information on our website through your groups. You could sponsor your own blood drive if you have a population, physical population in the area and can support a blood drive. We're happy to partner with you. We do have scholarship opportunity for students. We have a blood stock program where a student running a blood drive in their community is eligible to receive a scholarship based on the donations collected at their event. You could help us partner with different high schools across the area, different organizations. We do have some awesome contenders that I will give a shout out to the Department of Environmental Protection. They do an amazing job running blood drives. Actually, their blood drive is today at the Kingston Donor Center. So I'm sure they're very busy over there right now. We opened up on a Thursday for them. And you can also encourage people to stop in at the donor center. You can also have what we call a feed-in blood drive, where we give you materials and ownership, and you kind of adopt our donor center for a time period and encourage your members to come out and support and partner with us in that way. And also, finally, I do want to say that a lot of times we forget the end mission of saving lives. We want to collect the donations so they literally go straight to a patient in need. That's where I find people may be hesitant, they're afraid of needles, whatever the case may be, but they get over their fears, they take time from their day, they come and they donate, and they don't see that person receiving their blood at the end of the process. And this is where we have amazing blood recipients such as Kyle, who is an Ulster County resident. His family they live in, I believe they're in Plattekill. And at 16 months old, poor Kyle, his bone marrow was failing him, rushed to the hospital and was diagnosed with aplastic anemia. He needed bone marrow transplant, blood transfusions. He's undergone surgeries. He fought an amazing battle, and he has won so far. He's doing great. He's had some surgeries throughout the years, but he's now 9 years old. He's in school. He's living the life of more or less a normal kid, and it's through doctors, through nurses, through his family, and through blood donors, because the one thing that cannot be made and manufactured in this process is blood. It has to come from a willing donor donating just in case somebody needs it, because there will be somebody, and that somebody could be Kyle, it could be a whole slew of other people. We've done numerous blood drives in honor of recipients both in Ulster County and across the Hudson Valley, across our service area. They really help shake people and let them know that this is real. Your blood is not sitting on a shelf. Your blood is going to a patient in need. All right.
That's the end of our presentation. Yeah, thank you.
Well, thank you so very much. If everyone has questions, if anyone has questions, please do put them in the chat. You were sharing the statistics of the number of people that do donate blood. Does it happen at a particular time of year that there's a larger amount of people coming forward, or, I realize you do blood drives, those sorts of things, but is there something that makes, certain months more popular to donate? so to speak?
Yeah. So I guess I'll kick us off on that answer. We actually unfortunately follow the opposite trend. So because we don't really collect enough and it's a constant need, oftentimes people think of the blood center like a blood bank where there's a deposit and there's just full shelves. And truly we're more of a pipeline. It comes in, it goes out as fast as it comes in. We find that the winter and summer months are the most challenging only because with winter you have weather issues. And in the summer, everyone's trying to enjoy that short time that we have to really, be out and about. So the spring and the fall tend to be our more stable timeframes, especially to Joanna's point with our youth donors. When our schools are in session, we definitely have a healthier supply, but during those critical times where schools are not in session in the summer and for the breaks, we experience some drop off. I think they make up about 30% of our blood supply. So it's such a critical sector.
And what are other locations that you do collect blood at?
Joanna, do you want to?
Yeah, so some of the areas, and so we have our donor center in Kingston. We do have other locations if you visit our website, nybc.org. But locally, we do have community blood drives at New Paltz Middle School. They run one coming up in April. Our high schools tend to be closed to the public for security reasons. We have Rosendale Community runs a blood drive with us. Centerville Fire Department, they're actually just added. They did one blood drive last year and they're going to do 3 this year, which is amazing. Different churches, so St. Mary's down in Marlboro, they have a great Father's Day blood drive where they give pancakes and breakfast made to order for everybody. Walker Valley Fire Department, so we definitely are out and about, but we could always use more opportunities. As everyone here knows, being in Ulster County, just because you're in the same county does not mean it's close. You could be traveling quite a ways to get somewhere.
So we have a question from Lizette McNulty. Do you hold on-site blood drives at employer locations? I was actually thinking that myself.
So we absolutely do hold blood drives. If you'd like us to come to your facility, we need about 1,000 square feet or more of open space. We bring all equipment, all staff, down to the cookies. We even bring the cookies for you. We do look for at least 50 participants in the blood drive. So, if it's an initial blood drive that we're running, we'll have a conversation about what that looks like and if we can meet those numbers. And we provide all the tools. We provide flyers. We have a sign up portal. We have a coordinator portal. We really make it as turnkey as possible. We just ask for your support and your outreach and your hustle to help us get those blood donors to come to the event.
Well, that's great. Thank you so much. Does anyone else have any questions?
Well, I just have a comment. It just so happens I was there yesterday at the Kingston Blood Center, and it's so convenient for me because it's only 5 minutes from my work site. And I'm lucky because the county has a benefit where we don't have to take it from our sick bank. We do get a few hours a year to donate. So that really helps. And there's some really cool initiatives where occasionally you can get a $20 gift card if you donate blood. So they incentivize it. And I'm going for the all season sweatshirt, which is a hoodie. And I can't wait to get that. So, you'll definitely see me in there throughout the year. And if anybody feels nervous about going, I would schedule my appointment with you. I believe it's Mondays and Wednesdays here in Kingston at the Kingston Center. So, it's quick. I've been able to get in and out in about an hour, and it's clean, and the snacks are awesome. Lots of cranberry juice and
I was
Lorna
admiring your purple Band-Aid.
Yep.
So
So it's a good experience.
We can match your outfit.
I think we owe Stacy a little commission. That was the perfect commercial for this. So yeah, thank you. Convenience and And just the ask, just talking about it. Oftentimes people don't donate, they just don't realize it's something they can do. They don't realize it's easy. They don't realize it takes less than an hour. So just speaking about it makes such a difference. And like Joanna mentioned, and as Stacy mentions, we want to make it convenient. So whether it's coming to our donor center, or if you have enough folks where we can come to you, we're very happy to do that. We want to make it easy.
Yeah, and what I like about it too is they will check your iron. They'll tell you if your levels are good. They check your blood pressure, your temperature. So it feels like a little wellness visit, all in one. And I'm needle phobic, so it's challenging for me. But I always just kind of talk myself into it. And so if anybody needs help, I'm really available.
Wow,
Oh, that's
thank
great.
you.
Thank you so much. That was another great presentation. Jillian, I'm going to ask you to launch our evaluation poll, just that we get everybody's input on the presentation. And again, it's a really easy question. Was it relevant to your work or personal life? Great. Thank you, everyone. Okay. All right. So we're moving on in our meeting. Made it past our presentations. And we're moving into really our movement break, and followed by our movement break, we will also then move into our networking session where everyone will have a little bit of time to share something about their program. I'm going to let Stacy take it away. We're going to do a movement break based on to help everybody with avoiding carpal tunnel, which as we sit here in all of our Zoom meetings and on our laptops all day, carpal tunnel does become an issue. So Stacy's going to lead us in a little movement just that you learn some neat little tricks to do at your desk and when you're sitting there watching television at night to help avoid that feeling in your hands like they're clamped, which I'm always interested in because it seems to grow on you. You do need to work at it when we work on laptops all of the time.
And I'm just trying to get to the website, and for some reason, when I look at the sharing opportunities, it's being a little difficult here. But maybe if I click share screen, then I can navigate there, hopefully.
Yeah, sometimes it's easier to get it open and going and then share, but you got it. Yay.
Oh, you can see it? Okay, perfect.
Yes.
So this is Dr. Jared Beckstrand, and he has a website called toneandtighten.com, but he's a physical therapist and has some great quick things that you can do to help alleviate the symptoms of it if you're having some carpal tunnel issues, and some prevention exercises as well. So this is just 3 minutes.
You may have to also, when you share, there's a spot for you to share sound.
Oh, okay. Share sound. Ruh-roh. I'm not seeing that, but I'll just let you watch it anyway. So he's saying repeat it 20 times in each direction, and it should be pain-free.
So I'm going to try that as we're sitting here to see if I can do that.
So this is thumb down to the floor and thumb up to the ceiling, he's saying. And 20 repetitions. He says this is the best one. Saying if you're irritated from carpal tunnel being inflamed, this might be enough of a stretch. So you just take it as far as you can. You don't want to irritate it. Hold it for about 20 seconds. And then you come down, extensor stretch. And 20 seconds here as well. If you can tolerate more, use your other hand and fully extend as far as it feels appropriate to you. To a comfortable range. 20 seconds in each direction. And 3 times. The next one he says is more aggressive, but focused on the area and the nerve at play. Bring your hand in front of you. With your other hand, come around and grab your thumb. Hand is extended, you go underneath your wrist, and then you're going to pull. So this is a more aggressive stretch if you can tolerate it. So this is an alternate way of doing the same thing to get the stretch through the thumb. Okay, so you can find his videos on YouTube, and we'll put that link in the chat for everybody.
I did
Thanks
put the
for
link
watching.
in the chat. So if you want to watch the video just to learn, these carpal tunnel stretches on your own, you can save that right now. Thank you very much, Stacy. Much appreciated. I know that, as I said, we're all using our computers so much that, we're always typing and sitting. So we like to offer some movement training so that we can help each other with some of these issues with, our joints, and in this case, our hands and thumbs. Stacy, if you could stop sharing.
Okay.
We're going to move on into the part of our program where we all get to do a little networking. You just need to hit stop share at the bottom. There you go. And we have a few rules that we tend to utilize for that, just so that networking is smooth and we get through that. But before we do, I just wanted to remind everyone of our collective action. So part of what we do with the Healthy Ulster Council is we get together for professional development. We also get together for collective action and networking. And we've been working on the sugar sweetened beverage policy, and trying to get organizations to pass the policy to basically reduce the amount of sugar in beverages offered at meetings, work sites, and to offer instead water, seltzer, coffee, tea, 100% natural fruit juice. So I put this out on the Healthy Ulster Council Google group. If you're not a member of that, after this meeting, you will be. And if you can work with your work site to pass this policy, the health department also has these fantastic water bottles to share with your organization. So we've already had the City of Kingston's Health and Wellness Department pass this, and yay! So they all received these water bottles, and the idea is to promote healthy beverages in your work site and to model it for people coming in for meetings, and to just underscore that. And we know that the consumption of added sugars increases risk of chronic diseases. So just putting that out there. You'll be seeing it again coming this month. It'll be mailed to everybody with the option to, definitely pass a sugar sweetened beverage policy in your organization. So look for that in your email. I'm reminding everyone that we do have the Healthy Ulster Google group. After the meeting, I share everybody that's not already a member. You should receive an email welcoming you to the group. And the platform allows for you to directly share information to the Google group. And it's for all of the members that participate in these meetings, agencies and organizations, and people that come to our Healthy Ulster meetings, so that you can share your information with their organizations. And it allows you also, if you wanted to collaborate in Google Docs or Google spreadsheets with other members of the council. You also have opportunity to be on Healthy Ulster Radio, which airs Saturday and Sunday early in the morning. But the wonderful part of that is it actually records Wednesdays at 3 p.m. So you don't have to get up early to record it. If you're interested in sharing information about your program, please reach out to Stacy. Her information is on this slide, and it'll also be shared at the end of the meeting. But you can be on the show with up to 2 guests to share more information about your program. And, it's just a really great way to get information out. And we've had lots of people from my own organization have gone, and it's just a really wonderful experience. And now we come to our networking session. So this is where you briefly share your organization's upcoming program or event. You have, a few minutes. We have 20 people here, so we have to keep it short. So when I call upon you, state your name and organization, remember to say who you are, and briefly share an upcoming event or program that you would like everyone to know about. Focus on an event or a program rather than everything your organization does. And remember that you can also share more details, such as your website or program dates, in the chat. So that also will be there. And actually, I'm going to stop sharing there so we can do our networking. So this is where we sort of popcorn it around, and I'll just call on everybody that's on my screen, and you'll jump around a little bit as people turn cameras on and off. It is a great time to turn your camera on so we can see who's who at what organization, if you're comfortable with that. So I'll just reach around and read people's names, and hopefully you'll have a few minutes to share. So I will start with Vanessa Turner.
Hi, my name is Vanessa Turner. I work for Westchester Independent Living Center. New York Connects is the program that I am involved with. We help people with getting long-term service and supports. We help people find care and support, remain independent in their home, understand their care options, find transportation, find support employment programs, get answers about benefits, entitlements, and apply for Medicaid and other benefits. I serve Ulster County, Westchester Independent Living Center. New York Connects serves 7 counties. So we're a regional agency. Thank you.
That's
And I
awesome.
put my information earlier in chat, like everything, the toll-free number. If you have people from other counties, we do not serve Delaware. So do you want me to list off the counties that we serve?
Sure. Sure, you can.
Okay, so it's Westchester, Rockland, Orange, Sullivan, Ulster,